Well, good morning, good afternoon, and good evening, everyone, and welcome to today's International Federation of Infection Control Teleclass, sponsored by Weber Training. My name is Heather Stoltzfus, and I am a Research Nurse Program Manager at Johns Hopkins University's Department of Infectious Disease in Baltimore, Maryland, and I will be your host for today's call. We are absolutely delighted to have you here with us today. The IFIC Teleclass series brings infection prevention professionals together from every corner of the world, and it's always inspiring to see this level of global commitment to improving infection prevention and control. So I just want to thank you for taking the time to join us today. Today, we're tackling a big and important question: sustainability and healthcare. Can it coexist with infection prevention and control? And I know as infection preventionists, we often face what feels like competing priorities: keeping patients and staff safe from infections while also considering the environmental footprint of our practices. But do we really have to choose between safety and sustainability, or can the two goals move forward together? And that's the conversation we'll be exploring. We are so fortunate to have with us today two exceptional experts. Pike is the IPC lead and clinical sustainability lead at Great Western Hospital's NHS Foundation Trust in Swindon, UK. He is also the coordinator of the Infection Prevention Society's Sustainability Special Interest Group. And Quar'm brings a unique perspective as both an experienced nurse and a physicist specializing in atmospheric physics, which gives him deep insight into how healthcare can and must play a role in addressing environmental challenges. We also have with us today Professor Dr. Camila de Moraes Bruna. She is a professor at the University of Sao Paulo, and she has specialized in operating room, sterile processing, and infection prevention. She's devoted much of her academic and research career to exploring biosafety, medical device reprocessing, surgical site infection prevention, and sustainability. Her expertise in linking day-to-day clinical practices with sustainable solutions is going to be so invaluable to our discussion. Together, Dr. Quar'm and Camila will help us think critically about what sustainability really means for healthcare and what it looks like in practice, and how infection preventionists like you and I can lead the way towards safer, more sustainable systems. And with that, I'd like to hand it over to Quar'm to go first.
Thank you very much, Heather. And thank you all. It's a real honour to be here. And good morning or good afternoon, depending where you're listening from. As Heather mentioned, I'm both the infection control and clinical sustainability lead at my hospital, which is unusual, possibly unique, and might seem a complete contradiction. But as I'll hopefully explain over the next few slides, next few minutes, I think these two specialties are inextricably interlinked, and it's really important that they work closely together. I want to begin by defining the term, really. So this will either be a recap or education, depending on your level of expertise. But sustainability is a word that's used so much nowadays. But I think it's helpful just to reflect on what we're actually talking about. So if something is sustainable, it simply means we can sustain it, or we can keep doing it. And if we're talking about the use of a resource, that resource is not used up or permanently damaged. Or to put it more simply, if something's sustainable, we can keep doing it indefinitely without running out of resources. And of course, there is only one place that we can get any resource at the moment, certainly for the foreseeable future, which is the planet that we all live on. And it's a fantastic system that is constantly, generating new resources that we can use, breaking down waste products and turning them back into resources. It's amazing. It's also very big, but it isn't infinite. So there is clearly a limit to what it can produce, and therefore a limit to how much we can use sustainably. Are we close to that limit? Well, according to the Global Footprint Foundation in Geneva, we are well beyond that limit. So they have looked back every year from 1971 until last year, looking at what point during the year did we use up the biological resources that the Earth could produce in a year. So if you look back in 1971 on the left there, it was almost the end of the year when we used up what the Earth could produce in a year. And then you move to present day, and we're using 1 3/4 Earth's worth of resources every year, which means by the end of July, beginning of August, we've used up what the Earth can produce. So we're stealing from the future, from future generations. And that isn't sustainable. We cannot carry on doing that forever. At some point, we will be forced to be sustainable because there will not be enough resources for us to use. It would be better to try and find a way to be sustainable before we're forced to do it by the planet. The other thing that we talk about a lot, and I think it's worth just thinking about why when we're talking about sustainability, is carbon dioxide or CO2. Now, you'll probably be well aware that CO2 is not in itself a bad thing. It's actually quite an important part of the atmosphere, just a small part of the atmosphere. Typically, 180, 200, 300 parts per million over the last few thousand years anyway. So not a huge part, but it does keep the planet at a habitable temperature. So the sun is constantly, obviously, heating up the planet with radiation right through the spectrum, but the planet's surrounded by the coldness of space, so it's trying to cool down, and it reaches an equilibrium temperature. And CO2 is just the right size, shape, design to slow down that heat as it leaves the planet. So the planet reaches a temperature that's about 16, 17 degrees Celsius warmer than it would be if we didn't have CO2 in the atmosphere. So it's quite good that it's there. But of course, if we start burning things, wood, oil, coal, gas, whatever, anything we burn is going to release some CO2 as we burn it. And pretty much everything we do causes something to be burnt, whether it's turning on a light or driving a car or buying something or sending an email. Pretty much everything uses a little bit of power, causes something to be burnt to make that power. So it has a carbon footprint. And whilst the planet is amazing and can absorb CO2 along with all other waste products, if we emit more than it absorbs, there's only one consequence: it's going to go up. So we know it was 280 parts per million prior to the Industrial Revolution. So the late 18th century, late 1700s. By the time I was born in the mid 1970s, we've gone up to 330 parts per million. So it's gone up about a fifth in a couple of centuries. And then bring it to the present day, we hit 430 parts per million earlier this year. So that's 2/5 in just 50 years. So it is accelerating. And actually, half the CO2 that we've ever emitted as a species has been emitted since 1990. And we've been around obviously quite some time, tens of thousands of years, if not longer. And we knew about this in 1990. There have been speeches at the United Nations talking about how important it was that we got on top of this. And yet since that time, we have emitted the same amount of CO2 as we'd already emitted. So the planet is trapping more heat and is going to get warmer. Just some really, really broad context on this. You may have seen this. This is from NASA, showing how CO2 has naturally varied over the last 800,000 years. Because that's often one of the challenges people will put back to. We say, well, CO2 just naturally goes up and down. And absolutely it does. And NASA have got this data from ice cores and various other kind of proxies. So you can see it does naturally go up and down, and that's because of natural changes in the Earth's orbit or the strength of the sun. And those rises and falls are very closely aligned to the ice ages. So when the CO2 is lower, the planet gets colder and we're in an ice age. And when the CO2 is higher, the planet gets warmer and we come out of an ice age. And you can see on the right-hand side there that about 12,000 years ago, we came out of an ice age. And then on the very right-hand side of the graph, you can see that sudden spike beyond how high things have been for a long time. We have to go back a few million years before we get to CO2 at this level. And we don't think it's ever risen this fast. So we're in unprecedented territory. And we're seeing the consequences of that. Apologies, I'm being told I've got a bit of feedback. I don't know what I can do about that. So the consequences of that rise in CO2 we're seeing in terms of temperature. So this is from the University of Reading in the UK, showing how temperature has changed over the last 2024 years. So the blue lines are colder than the average in the 20th century, and the red lines are warmer. So you can see, obviously, there's been quite a shift towards warmer temperatures, and the scale is there on the right-hand side. So you can see we're about 1.5 degrees warmer than the pre-industrial average. Now 1.5 degrees doesn't sound like very much, and I think that's part of the problem in people grasping the the importance of this. But when you start to think about how much energy it takes to warm an entire planet by 1.5 degrees, it gives you, I think, a better sense of the scale of things. Another climate professor from the University of Reading has calculated that at the start of 2023, the planet was warming at a rate equivalent to all 8 billion people on the planet, each boiling 60 kettles. Boiling up the ocean with 60 kettles. That's quite staggering. There's a retired maths professor in the States who has looked at how many atomic bombs would it take to raise the temperature of the planet by, actually he was looking at 1.2 degrees at the time. And he's calculated it would be 6.2 billion. So if we wanted to heat the planet using nuclear bombs, and we started doing it in 1950, we'd have had to explode 2 every second until the present day to warm the planet by 1.2 degrees. So it's a huge amount of extra energy that is trapped in the system, in the planet. Why does it matter if we have a warmer planet? Maybe that's great. We can have warmer holidays and be lovely. Well, if you heat up a pot of water on the stove, as it starts to heat up, the water starts to swirl around unpredictably, doesn't it? And that's what we're sort of seeing with more unpredictable weather, more storms, as well as obviously more heat waves because the planet's getting warmer. We know that ice caps melt, obviously, as the planet gets warmer, so sea levels will rise. That will give us flooding, but also we get flooding from the storms increasingly, and we've seen that across the planet over the last few years, all over the place. So there's land loss from flooding. But also land loss from parts of the planet being too hot or too dry to grow crops as well. So an obvious impact on food supply, increased competition for resources, whether that be food or water or land. And we know when humans compete for resources, it doesn't tend to go well. There will be conflict, there will be an increase in migration and all the health inequalities that come with that. And then there are certain climate tipping points that we would really like to avoid, because if they happen, the planet will start to warm faster and it's very hard to go back. One of those is the loss of the ice caps, actually. So if the ice caps melt, one of the useful functions they serve is they reflect a lot of the sun's light straight back into space without it warming the planet. So if you lose the ice caps, you lose that effect and the planet will warm faster. And obviously it's hard to put the ice caps back. This is from the CDC in America. Looking at the impacts of climate change on the planet. So you've got that vicious circle in the middle of rising CO2, rising temperatures, more extreme weather, rising sea levels. Then you've got the direct consequences on the planet around that, the increase in air pollution, the changes in vector ecology, and so on. And then the outer circle is the consequences of those on human health. And as you can see, it's every aspect of human health, whether it be communicable disease, non-communicable disease, mental health impacts, injuries, fatalities from severe weather and from forced migration and so on. And if we're thinking about just the relevance for infection prevention and control, well, changes in vector ecology are clearly going to have an effect on the diseases that we're all dealing with. It was predicted a couple of years ago in the UK that we would start seeing mosquitoes carrying some of these diseases in about the mid-2040s, but actually West Nile virus was detected in mosquitoes last year here. So it's happening faster than we thought. Down the bottom, we've also got the water quality impacts, again, an impact for infection prevention and control. We've got malnutrition, diarrheal disease. There'll also be an impact, which isn't shown on here, on antimicrobial resistance as well, which is another thing we're obviously concerned about. So it is relevant to infection prevention and control, without a doubt, and that's why as well as to the rest of healthcare. And that's why the World Health Organization described climate change as the single biggest health threat facing humanity. And if we're all health professionals, I would argue maybe it should be a bigger focus of ours as well. But of course, we're part of the problem too. We've got a carbon footprint like everybody else, and our carbon footprint isn't small. It's about 4.5% of global emissions. If we were a country, if the health sector were a country, we'd be the 5th largest emitter on the planet. So we are, in a sense, creating our own patients by the emissions that we cause. That's not sensible and it's not sustainable. What's it got to do with infection prevention and control? Well, how many of the healthcare practices that we see, the products we use, the way we use them, the way we process products and reprocess them, the waste we generate, how much of that is due to how we're reacting to infection prevention and control risks? A huge amount of it. And sometimes, absolutely, those risks are real and the measures we put in place are are needed. Often they are not, and we can all think of examples. I think of people thinking they're doing things for infection prevention and control reasons. Misuse of gloves is a good example, I think, but they're not. And we need to be aware of what has recently been coined yellow washing. You've probably all heard of greenwashing or yellow washing. That's when defined by Professor Buter on the right there from University of Sussex Medical School. It's basically when we're using infection prevention and control as an excuse or a reason not to do things when actually the evidence doesn't back it up. People say, oh, we can't do that because of IPC. Well, actually, have you asked IPC? And if they've said no in the past, well, actually, we need to reevaluate it. We need to think, what is the real risk we're trying to mitigate here? Use our IPC expertise to tell the difference between the things that we can change and the things that we can't. We need to be the ones who can step up and enable that change, because there's that perception that we are a barrier. There seems an inherent contradiction in my role, a lead for clinical sustainability and for infection prevention and control, but actually there isn't. It just means it's more important that we step up and lead on this. And when we're deciding what mitigations we're putting in place, make sure we include the consequences to the planet in that risk assessment. If we're using disposable equipment, do we really need to, when we know what the consequences of that are? So what can we do about it? As I said earlier, the planet is a fantastic system. It can recover, it can regenerate, but we've got to help it. We have to reduce consumption. We cannot keep taking 1.75 Earth's worth of resources every year. At some point, as I said, we will just have to stop doing that. Better if we can do that in a planned way. And if we have to use things, which obviously we do, can we reuse them as much as we possibly can? And if we can't reuse them, at least can we make it go for recycling? And there's other things actually we can't reduce, reuse, recycle, but can we make better choices? Can we refine our choices so we minimize the impact on the planet? I mean, the example I would give here is chlorine as a disinfectant, which is used widely in healthcare. But we know that chlorine damages surfaces, damages the fabric of buildings, corrodes equipment, isn't actually particularly effective against in dirty conditions, gets inactivated by soil and dirt. So isn't necessarily the best product anyway, and is a respiratory irritant. And there are other technologies out there like peracetic acid or hypochlorous acid. So could we just think about better choices? That phrase, reduce, reuse, recycle, has been around for as long as I can remember, but it's really important we think it in that order. Reducing has to come first. People will often talk about recycling in the context of sustainability, and while it's part of the solution, it's not going to be the answer. So here's a supply chain from mining of a raw material, turning it into components, turning it into a product, sending it to a hospital, maybe it being used and it's just thrown away. Typical linear supply chain, such as we see for most products. And each step in that process has got a carbon footprint of its own. So the more we can cut out of this, the better. So if we recycle things, we're not mining or extracting new material, and that's important. As I showed at the start, we cannot continue to extract material at the rate we are, but we're not stopping any of the other stages of that process. So we're still having to turn that back into product. If we can send products back to manufacturers, it's particularly pertinent for some of the more complex surgical equipment like harmonic scalpels and so on. That are really complex, a lot of electronics, a lot of plastic, a lot of metal, and often these are just used once and thrown away. But actually they can go back to manufacturers. Increasingly there are remanufacturers doing this and turn them back into usable products. But if we can reuse things locally, just by cleaning them locally or decontaminating them locally, whatever's required, even better, we cut out more steps of the process. But of course, if we don't use the product at all, it's got no carbon footprint. So if we can reduce, that's where we've got to start. And then we can think about what we are using. Can we find ways to reuse it? So when we're thinking about reducing, what do we really need to use? We use a load of PPE, gloves, aprons, all sorts of things in situations where we really don't need to. And I could go onto that for hours, but we don't have time now. Skin prep, we've done some work here looking at routine skin prep before routine blood tests. Is it always needed? Couch roll is used a lot, certainly in the UK, which is that paper cover that goes over a couch when a patient sits on it. We don't use it on a chair. If I go and see my GP, there's no chair roll, but suddenly if I go onto the couch, there needs to be a couch roll. Is that really needed? What purpose does it serve? If we're using things do we have a really good rationale for why we're using them? Is just in case a good reason for a lot of things, catheters, cannulas, and so on. And in a lot of sustainability projects where you're reducing those things, there's a IPC benefit alongside that if we're reducing unnecessary cannulas and catheters and so on. Absolutely, we've got to think about the energy, water, and transport used, both in our use of those products, but also how those products are made. And what we do as infection prevention practitioners around prevention is a really important part of this. The lowest carbon episode of healthcare is one that doesn't happen. So the more we can prevent people getting unwell, preventing them getting infections, educating patients to keep them well, that's a really key part of reducing the impact of healthcare on the environment. Reuse. So there are alternatives to a whole host of single-use products out there. They're not all widely available, but they are increasingly becoming so. The ones I've underlined here are products that there are already reusable versions of these out there. They are, in some cases, quite limited. Aprons is a good example, but we've done some trials of that in the UK, reusable aprons that are wiped down several times during a shift and then sent for reprocessing. And one of those can replace 1,500 plastic aprons that are used certainly widely here. But the others are all more widely commercially available. So why are we still using the single-use ones? I know there's some logistical challenges to that, but we've really got to focus on this. And masks and anaesthetic masks are things I'm aware of where there are trials in the UK to get reusable ones brought to the market. And there will be more of these kind of trials coming along. And I think as IPC practitioners, we need to be open to those and wanting to be involved and try them and see if we can adopt them. Recycling, we've got to encourage the proper segregation of waste. You might think this isn't really much to do with infection prevention and control, but actually we're often involved in those discussions around, what bins are needed, where do they need to be, how do we segregate the waste? There's a big difference between the carbon footprint of sending something for an incineration and sending it for recycling, and it also saves money. So, and actually that's the case for a lot of sustainability initiatives. You'll save money as well. So it's often quite good to get people on board using that motivation. I'd encourage you to look at the videos that you can find if you scan that QR code or go to that in that URL. The lady in the center here is an artist from the Netherlands who had breast reconstruction after breast cancer, and she asked the surgeon to keep all of the waste from her procedure. And that is what you see in front of you. And she just, it's a really good video that, and other videos for other procedures as well. And she just poses the question, is there a better way? And there has to be a better way. Did all of that surgical equipment need to be disposable? Did everyone need to wear gloves? Who wore gloves? Were they all touching body fluids or needing sterile gloves? I doubt it. There are reusable gowns. There are reusable drapes available. Why are we using disposable ones? There is a better way. So yeah, do have a look at that. And as I talked about earlier, we need to make better choices as well of the products that we do need to use. Can we choose the ones that have the least impact on the environment, both the carbon footprint, but thinking about the damage to water courses and so on if things get into the environment. We've done a report in my hospital, Great Western Hospitals, on some very small projects that we've done just by working with our sustainability team alongside the infection prevention and control team to look at some examples of where we can reduce use of gloves, reduce use of couch roll and linen and skin prep. And so if any of these are of interest to you, then do absolutely have a look. Again, there's a QR code here. The address is at the bottom. They're just some examples we've come up with. We're all striving to try and get towards a net zero health service. Nobody knows what that looks like. We've never had one before. We are in uncharted territory. So no one can tell us what that's going to look like. It's going to need all of us on board with our own creativity, innovation, ideas, inspiration, and so on. You might think of an idea that no one else has thought of. That doesn't mean it's a bad idea. Talk about it, share it, try it, and then share it so that we can all get on board so we can solve this together. We're coming towards, really, as in terms of the planet, the last moment where we can turn this around and maintain a habitable planet. So I just want to leave you with these two questions before I pass on to Dr. Camila. If not you, who? And if not now, when? Thank you very much.
Hi everybody. Thank you a lot for the invitation to speak with you all today. It's an honor to be here and talk about such important and interesting that it's sustainability. As my colleague just talked about sustainability in general in healthcare, I will focus on operation rooms and medical devices reprocessing. I know I don't have any conflicts to declare, and as Dr. Graham just stated to you, healthcare facilities has a huge impact in the environmental sustainability in many ways. And when we think about surgeries, the operation room and the theaters, the surgical theaters, usually are the most impactful unit in the hospitals when we're talking about waste, electricity use, and the impact, the environmental impact. And the point is, we are in the planet, or in all the planet, we are getting much and much more interventionists. The healthcare, it's being more and more doing interventions and not preventing, and that's why we are getting more and more surgeries all around worldwide. When we look to the impact of surgeries, we can see waste as a big problem, the use of electricity, and the gases from anesthesias. And when we look to the waste that we generate on operation rooms and when performing surgeries, we can see that despite the fact that everybody thinks that all a surgery produces its hazard waste, it's not like that. Most of the waste produced inside of operation rooms are known hazard waste, but we treat and dispose those waste like they were hazard, and they have to be treated as it. So we can talk today how to prevent and how to work, especially in the use of electricity, emission of CO2, and waste. When we were talking about the use of electricity in the OR, in the surgical theater, the great villains, the biggest problems are the use of air conditioning, and for that we can think about how can we use presence sensors to turn it off when it's not in use, or just think about the use of the lights. So now we have, of course, a lot of LED lights that are consume less energy than others, and we can use also presence sensors for those also. So because not all the rooms in the surgical theater are being used all the time, all day. There are some surgical centers that some rooms are kept closed for the night or for the weekends, and we can think about those use. And there are two great problems when we think about anesthesias and emissions of CO2. There are the gases that anesthesias use, especially desfuran and nitrous oxide. Here in Brazil, so I imagine are all around the world, in another place, especially in the high-income countries, we are lowering the use of these gases. So this is an important thing to do and think. So when we think, okay, how can we think in a sustainable way to work on the operation rooms, surgical theaters? So we have to think about the disposal of chemicals. There is a huge problem around it. Do we need to dispose all those chemicals? Can we reuse some of them in some way? Let's try to work in reducing the gas flow, even oxygen. It's really important to routinely check for leaks from these gases, especially, and try to use less and less of desfuran in nitrous oxide. And what we see usually in the literature is that local anesthesia always has less impact in the environmental sustainability than the general anesthesia. And we need to do what we are doing here. We need to educate on sustainability. We need to make people sensible to it. We need people to think about it when they are doing their professional workers or whatsoever. And like when in our home, we need to think about it. Even when we are persons or when we are professionals, we need to think about it. As Dr. Graham said, when we think about it, it's always about consumption. It's the way we consume things in this planet that it's leading to that. All the impact goes around and comes back to consumption, the way we consume things. And even the gum that I put in my mouth that I have to throw away sometime in some point. And when I'm taking care of someone, when I open a compress, something to take care of the people. So when we think about consuming the operation rooms, something that pop up as a very big problem, it's the way we, it's the problem with the kits we use in surgery and the way our trays are designed and the way we keep using it without thinking about it. So we create huge kits to use, surgery kits, with a lot of plastic things, a lot of disposable things, and also things that we can reprocess. But there is literature about the reduction. For example, for trays, you reduce the tray and take off this tray, all the instrument that the surgeons are not using at all during a surgery. And you can save water, detergent, time, and there is an impact, a financial impact, an impact on the environmental impact. So we just have to think about it. We just have to don't be lazy and try to work where I can reduce our consumption. So, because what we see in the operation rooms and sterile departments, it's that we are using a lot of plastic, and I I don't like to think about recycling because we have a lot of problems with recycling, especially plastic recycling. We have evidence that recycling plants of plastic are generating micro nano particles of plastic. And here in Brazil, it's almost a fallacy that we can recycle plastic. So we have to be very cautious with plastic. And when we saw the use of plastic in the operation room, it's massive, and we think about it. If you have to use, you have to think how you will manage it. And it is important for that to find someone, to identify that people that like this subject, they like this, to talk about it, for whom sustainability it is important, and will pass it through to their colleagues and make it work on where you work. And Dr. Quar'm talk about a lot of use of PPE, and I see the same here in Brazil, and I believe in all the planet we do the same. We use too much glove, way more than we really need to. What I see in the surgical theater, it's people wearing gloves to touch everything. Not only body fluids, but surfaces, patient skins. But the glove will be thrown away sometime. It will be waste, and it's always what we are seeing in the healthcare. It's the use of plastic as a way to make patients safer. But what we see, I'm a reprocessing specialist, so we can reprocess all kind of stuff with safety for the patients. We are doing it for a long time. So I'm urging you to be very cautious when you are choosing a plastic material instead of a material that you can reuse, because it's a huge amount of plastic being thrown away. And even when you choose a technology, a healthcare technology, doesn't matter if it's only packaging system or tomography. It has a life cycle. In some point, you will have to throw it away. And there's nowhere to throw it away outside these planets. We only have these planets. Because in the long run, everything is disposable. At some point, you will have to dispose. So always, before open something or implement or institute a protocol to use some healthcare equipment, think about it. When this thing will be thrown away, and what is the impact of this waste on the planet. And I like this study here because it shows, and it compared the ophthalmologic surgeries in India against UK. And in India, they reuse a lot of material. And I'm not saying that we can reuse everything. It's not it, but they don't have more infection than other countries, and they reuse a lot. In sterile departments, in sterile processing departments, we are specialists in reuse things. We take things dirty, contaminated, and transform them in sterile things. So we are able to do that. And to do so, we need to use a lot of energy, water, and use disinfectants, for example, detergents. And we can work on sustainability in reprocessing medical devices also. We can think in the water consumption of our equipments. We can think about how to turn it off, our equipment, when they are not in use. We can think that usually equipments, automated cleaning, for example, usually saves more water than manual cleaning. And we need to start to put in our guidelines a way to think about sustainability. In general, our guidelines, they don't talk about how can we be sustainable when reprocessing or otherwise. And because another thing that is important, and us as healthcare professionals, we need to start to demand from the industry that they produce products that we can save material, because a lot of times we have to open a sterile material and we use just one piece of this product, but we have 10 pieces inside it, and I will throw away the other ones. And we see this a lot when we are talking about consignment materials that we lawn materials from companies, that materials that are not from the hospital, like screws or other things, and they are very expensive to reprocess, and it's very time consuming to reprocess. They use a lot of human resources to reprocess. And here in Brazil, we have many times surgeries canceled after all this work. So canceling surgeries, it's a way to impact the environment. So you have to think about how not to cancel so many surgeries. And other thing that we need to think about is the way we use disinfectants. We already know they impact environment. They impact even the rivers, the fishes that are in rivers. They are impacting not only the way we have some kind of resistance to disinfectants, but the wildlife also. We are starting to have some green disinfectants. We have a lot of difficulty with them because they are very hard to scale up, because sometimes they are the prime material. It's very expensive, but they might be an option. We have to start to think about it. And when we thinking about use them, there are some stamps that you can search for to think about how can we use this disinfectant in the way that it's less impacting to the environment. We still are working on it. We don't have even a correct name or one name to call them, but what we see is we are working on having less hazardous disinfectants to the nature. But it's important to think, if you can use disinfectant that it's sufficient to kill what you want to kill on that surface or equipment, it is already sustainable, because you're not scaling up to other disinfectants that can be more harmless than what should be. So what we see, chlorine, it's a very hazardous disinfectant, and peracetic acid, it's less. So you can work on things that are less or more important. And there is an interesting study that I'm showing to you, that you can use those items to look well, I'm using a disinfectant. I will start to buy a new one. I will implement a new one. It's a novel technology. How can I evaluate that and think about it? How I will use it in my healthcare facility? Because the antimicrobial resistance, it is also a matter of planetary health, and we need to think about it as it is. And using disinfectants like everywhere. I don't mind. It's a super disinfectant just to clean a non-critical material or not. It has impact in environmental sustainability. So we have to think about it. Because we need to break this vicious circle where the healthcare impacts environment, and the environment makes people sick, that those people sick needs to go to healthcare that impacts the environment. So we need, as professionals of healthcare facilities, we need to work on that. But we have a lot of barriers, and I know that. And they usually are because sustainability and planet health are not our primary task when we are taking care of people. So we need to start to think that it is our primary task. It is important to think about it, and it is urgent. It is now. We need to think about it now, not let it there. But for that, we need to escape the rat race. We need to think out of the box. We need to start to working on that, on our everyday tasks in the healthcare. So that's what I have to say to you today. Thank you very much.
Thank you so much, Dr. Camila and Graham, for your presentations today. We do have a few questions here, and I see we have some time to take some questions. So I'm just going to run through a few of these questions with everyone. The first question that I am seeing here is for Graham. It looks like you both highlighted the concept of yellow washing, but where infection control is used to justify unsustainable practices without strong evidence. Graham, I'm wondering, can you share some examples for how we can question and challenge those assumptions in our daily work, particularly with leadership in our institutions?
Yeah, I mean, I think that's key, actually, leadership, and it requires people who've got the correct expertise, which is us in infection prevention and control, to be able to identify those areas where it is being used as an inappropriate barrier. And I think it's really powerful when you have someone from IPC coming and saying, could we think about doing this differently? Whereas people would normally not even consider it because they'll assume that it's not possible because of IPC. I mean, a really basic example, I suppose, I don't know what it's like in every country, but certainly in the UK, the routine is that we change every patient's sheets every day. Why? There's no infection prevention guidance that says we have to do that. There's no evidence that I've been able to find that says we have to do that. And we know it's not routinely done in every country. And who changes their sheets every day at home, or even if you go and stay in a hotel? So we've introduced a process in my hospital of doing it twice a week for most patients. If patients are isolated for infections, certain other circumstances, obviously if the sheets are wet, dirty, whatever, we'll change them if the patient wants them changed. But just actually starting to have those conversations with those ward teams, and it made them start to question other things. Oh no, could we think about, how about we could reduce our use of paper, or this plastic item that we're using. I think just starting that conversation gives people permission to start thinking what else could be done.
Thank you for that, Graham. Dr. Camila, I'm wondering if you have anything to add to that conversation from the perspective of the OR and gaining leadership buy-in for sustainability.
The leadership Um, I think we are always trying to create problems to start do new things. It's not easy to change behavior. Um, and since HIV, we think a lot of we need to use disposable things. We need to use just one use disposable. Né? You use only once, even if there is a lot there. So I think what we need is to back to basics and back to understand what is the impact of not using a disposable one. We have a lot of experience, especially in low income countries, reusing things there that are microbial barrier safe. They are safe. And that's a way to think about it, I think. I don't know if I answer your question.
No, that's perfect. I think this is a great conversation. And it kind of goes into this next question that was for you as well, Dr. Camila, asking, what do you see as the biggest barriers to scaling these practices, sustainability practices globally? And how can facilities start to make small practical changes toward that?
It's always human behavior. It's always hard to make people believe that they need to change. What I see in my practice and with my among my friends, it's the lack of sense of urgency. But what we need, I think, a great thing to do is to find the people, the positive divines that we use in IPC, the people that wash hands more than others, and we can use it as a leader to sustainability. We can identify these people and give their tools to work sustainability. So we need to start changing small things in the OR, for example. We need to teach the surgeons and the scrub persons to segregate correctly the waste. When the patient go inside the OR, people start to throw away the waste as it was hazardous, and it's not. Sometimes it's not. If the waste don't have any blood fluid, you can think even in a recycled. So you need to train them and separate the recipients for waste in the room in a way that it's possible for them to proceed the surgery and segregate correctly the waste. I think it's a beginning.
Yeah, and I think that's where we need to start, right at the beginning. No, that's great. Thank you for that context and that comment. I really love this question here. Dr. Graham, you had mentioned that IPC expertise needs to separate real infection risks from perceived ones. And I think this question, I love the way that this is thought out, is how can IPC professionals incorporate the planet into their risk assessments without compromising patient safety? How do we keep the planet as a part of our risk assessment practically? What does that actually look like?
Yeah, good question. So I think, we're risk assessing all the time in IPC, aren't we? Deciding what interventions we do need to put in place, and we don't, taking it to an extreme, we could absolutely minimize almost to zero the chance of any healthcare associated infection by treating every patient in a clean room and using head to toe kind of hazmat suits and disinfecting absolutely every surface, throwing away the bed once it's been used. But we don't do that because we know that would be ridiculous. And then at the other end of the extreme, you've got, we could reuse everything and not clean anything. So it's just about thinking of where is the balance correct. If we are, as Dr. Camila was saying, do we need to throw that thing away? Do we need that to be single-use plastic? Is there a genuine reason why it can't be done any other way? Because we know there is a planetary consequence to using everything. So can we find a better solution? So it's not even about saying we have to throw away caring about the infection risk. No, it's just, is the way we're managing that infection risk correct? Is there a way that we can do it which doesn't impact the planet in such a way? I don't know if that helps.
No, I think that's really helpful. So this question, kind of to wrap us up for questions, is for both of you. And if you could recommend just one first step that IPC professionals could take tomorrow, what would you hope they would do to integrate sustainability into their programs?
Want me to go first, Gray?
Sure. Yeah, absolutely. Thanks, Dr. Camila.
It's okay. It's okay for me. I think it's if I think in a first step for IPC, I would think reduce the use of gloves. We are using too much of them. It's a great start, right? Because it has a grateful impact, because there are too many PPE being used when it's not necessary. I don't know about your practice, Graham, but here in Brazil, people put gloves all the time.
Yeah.
For everything. Yeah, that is a good start, I think. I'm curious to hear about yours.
So I would suggest go and have a look in your waste, in your bins, in your trash, and see what's in there. What is taking up most of the space in there? What is frequently put in there? And then take from there, okay, what in there could we use less, or could we reuse, or could we find a better product? But start by looking at what you're throwing away.
I love that. And as infection preventionists, that resonates with us. We're always doing assessments of various things and investigating, right? So we're investigating our waste. And I think it is different for all of us, wherever we are in the world, as far as how we're managing this. And I saw that a few times in some of your tables and some of the data that you guys presented nicely. So I think that is it for today for questions, but I just want to thank you both again for sharing your expertise with us today on the call. You've given us so much to think about. I know for me, at least, you've really shown us that sustainability and infection prevention can go hand in hand, and they really need to go hand in hand if we want to build a healthcare future that's going to protect both our patients and the planet. So I really hope that everybody does take this information back, continues their conversations with their own organizations, with your own communities, wherever you live in the world. And thank you so much for joining us, whether it is your morning, your afternoon, or your evening. Your engagement and this commitment to advancing infection prevention and control are really what makes these sessions so powerful. And, just knowing that we're making changes around the world is really, really exciting. So thank you guys all. And on that note, I wanted to share with you all some upcoming Weber trainings in infection prevention and control that you can check these out. We look forward to also being on this list with IFIC and being able to present you with other speakers and other topics in the future. Also wanted to just sincerely thank our sponsors for this Teleclass education, our patron sponsors. It is really with them that we are able to offer this education, and we are really deeply, deeply grateful to their commitment to advancing infection prevention and control worldwide. So with that, I just want to thank you all again for joining us, and I hope you have a great day or evening wherever you may be.